main building for office visits, chemo, lab, whatever.
Okay, so altogether that's 4 times 4, 16. Wait.
So four plus 4, 8 treatments.
8 treatments.
Every 2 weeks.
Every 2 weeks.
Which would be 16 weeks.
16 weeks. Okay. So that's the IV.
Yep.
Okay.
And they're about 2.5 hours when you come.
Okay.
So one day every 2.
Cause I'm off Tuesday and Wednesday, so I'm trying to be here.
Good.
Right. So I'm trying to make sure I bring everything.
So
into
yeah.
the area. Right.
So what you could do is and we like to see you in between each treatment. We see you on your off week. So when you to see what side effects you had, because then we can adjust your dose based on your side effects. So let's say you start on a Tuesday. Then we would see you the next Tuesday to see what side effects you have, and then you would get the infusion the following Tuesday. So you would have something every Tuesday for 16.
Does she got to watch her diet too in this process?
The only thing I would say about your diet, because we don't want to limit you too much, because it can affect your taste buds, and so we want you to be able to eat well. The only thing I want to restrict you on is no sushi, raw stuff. And you want to be careful with no salad bars. If you want to make your own salad, you can wash it really well, but you don't want
salad bar contamination.
Yeah,
I got you.
You don't want to be exposed to if you go to a salad bar and you have other people that are
or Oriental buffets.
Right, like that. A lot of the buffets are in general not a good idea, just because there's other people.
So I worked at the Palace, so we used to eat there, so no more eating.
Yeah. So you want to avoid the buffets, but you can go to a restaurant and order something cooked off the menu.
Gotcha.
And you don't want to eat raw tuna. You want to cook it a little bit. Just make sure. The general rule is basically, if you can cook it, that's better than
to go
raw.
out and eat it. Okay.
Yeah.
Okay.
And
then what about little things like nails and
the nail beds? So the nail beds may turn a little bit dark on the base.
Okay.
But they won't fall off.
Okay.
And when you quit chemo, that'll go away.
Okay.
So I can get my nails done?
You can.
That's like a necessity.
It's like a necessity.
In case she messed my family one of the only good things.
Right.
I knew the hair was gonna fall, but people go take your polish off and stop
No, you can get your nails done.
Okay. My nails off.
It's fine. We do an ultrasound of your heart before we start chemo to make sure your heart function is normal. Because with the adriamycin, if you have a normal heart, it doesn't cause any problems. If you have a lower heart function, then we don't use the adriamycin. Okay? But I think you're going to do great. And before you know it, we'll be done. And we do use a port. The port.
Oh, you gave me hope when you told me to get my nails done. Now I gotta have a port put in. Oh Lord.
Port's easy. So what they do, it looks like a little nickel underneath your skin, and it's about a 20 to 30 minute procedure by our radiologist. So they give you a little medicine to make you calm, but they don't knock you out completely.
So she can see it.
And then, and then they slip it in a vein underneath your skin. And you'll like it better than not having it, because if you don't have it, your veins get real beat up, and they have to.
How strong is the chemo? Is it a certain level or a certain?
So it's considered pretty aggressive for breast cancer, but every chemo is based on your height and your weight, so it's not like you're going to be overdosed.
So it's not a type. I thought it had a name for it, or.
We have the chemo names like adriamycin, Cytoxan, and Taxol, but I would say it's on the more aggressive end for our breast cancers. For our young patients who are pretty healthy otherwise, we tend to give them the best that we have, and it is the best that we have.
And that would be, what name is that?
AC.
AC followed by T. So,
AC followed by T?
yeah.
Okay.
So when you look at it on the internet, you can put AC followed by T.
And that's what it's called,
it'll-
okay.
And so after all that's done, will I have to take the pill?
No, because you are estrogen negative,
Okay.
so you're not going to benefit
From
from
the pill.
a hormone blocker.
So afterwards then for me it's just gonna be the constant following up
Yes.
to make sure that it has not returned.
We're going to follow up. We have a couple ways that we follow it. We have tumor markers, which are blood tests.
Mhm.
We do like exams, physical exams.
Mm-hmm.
And then also we offer radiation if you have any positive lymph nodes.
Mhm.
They consider radiation to just your axillary area. That's generally after chemo.
Okay,
Okay?
okay. And that's not something I have to do, that's,
We offer it.
okay.
The
What would
chemo-
you recommend it?
So we do recommend it.
Okay.
It's not as strongly recommended as the chemo.
Okay.
And the reason I'm going to tell you this way. The chemo goes throughout the
The whole
body
body.
and protects the whole body.
Mhm.
The radiation really only prevents like recurrence in your
That area.
axillary lymph node.
Mhm.
It used to be 5 years ago in our guidelines that if you had 1 to 3 lymph nodes,
Mhm.
you did not need radiation.
Mhm.
They have since seen that a few of those patients do
Mm-hmm.
recur. So now they are offering radiation to any woman that has lymph nodes that are positive.
Okay,
So the guidelines have changed a little bit.
gotcha.
So we offer it and it's recommended, but the chemo is kind of an absolute recommendation, and then the radiation is important, but I don't think it's as equally as important as the chemo.
Gotcha.
So, but I would do both. I mean, you're young, and anything we can do to
Just do it.
stack the odds in your favor, I would rather do.
Okay.
You know.